Good morning and welcome to Let's Talk. Thank you for joining us for this half hour. Now, let's talk.
And good morning and welcome to Let's Talk. I'm Tracey Morgan. Always nice to have you around this time of the day, just about 11:15. And that means it's our time to sit and chat with great professionals in and around Butler County. And we even extend beyond Butler County, as a matter of fact. But we talk about issues that are important to you right here in Butler County. And today we are talking with Dr. Brian Donner. We've talked to him before with Compassionate Certification Centers. And if you missed our conversation before, we're going to be talking about the same topic that we did in our prior conversation, which is medical marijuana, the cards that you would need. How do you use those cards? How do you get the cards? Before we welcome the doctor into the program, let me just give you the quick list of how you can listen, because you can be with us as we broadcast live on the radio, on the app on your smartphone, online at WISR680.com, and Alexa-powered devices. That's the last one I'm forgetting. So if you just say, Alexa, play WISR 680, that should be enough. Now, if you have to leave us today, this is our podcast of the day. So what you do is you go back on our website, pick programs, Let's Talk, and then look for our unique programs. We have this category that's just one-time airs. I know I just said we talked to the doctor a couple weeks ago, but we're going to put this in that category again. So look for that special programming folder under Let's Talk. All right, so Dr. Donner is with us today. Dr. Brian, how are you today?
I'm doing very well, Tracy. Thanks. How are you?
Good. Thank you, and welcome back to the program. We kind of joked before that this could take all day, but in reality, our conversation could take all day with your topic.
Well, and I'm glad to be back. It's perfect timing. So, and you're right. We could probably talk till the sun goes down and back up again.
It is such a huge topic, and it seems to, I say shift in the way of numbers. I was just watching this morning when, I can't remember what program it was, but it was just in the news as I was getting ready, and they were talking about the opioid crisis, which we can get into, and the numbers that go up and down. In some areas see, great improvement. You say that medical marijuana can help with this issue. Is that right?
Yes, I do think that medical marijuana can help with regard to opiate addiction and the opiate epidemic. I think we had touched base briefly during our last conversation how Pennsylvania was one of the first, if not the first state to put, opiate addiction or substitution therapy as an actual indication for patients to receive their medical marijuana card. And there's also been research put out there that has shown by the American Medical Association that's shown that states that have active medical marijuana programs have about a 25% less opiate-related mortality rate compared to states that don't have programs. So I think we are seeing real-time evidence that it could be an effective treatment.
Dr. Donner, let me first ask you this before we get into too many other details and too many other avenues. You're representing Compassionate Certification Centers, the CMO co-founder of this. What do you do at these centers? And, of course, we have one at 127 East Cunningham Street right here in Butler. But what do you do at these centers?
Yeah, great question, Tracy. Really what we do at these centers, I like to refer to us as we're a full-service medical marijuana healthcare organization. So really what we do is we function like any other doctor's office and with the special attention to medical marijuana. So we are able to see patients, take them through the evaluation process, help them obtain their medical marijuana certification and card, and then also provide ongoing support and care services for them, just like any other physician would. And in addition to providing certifications, we also have our own brand of CBD products and can help patients with that type of therapy. And we've started to do a little bit of clinical research as well. But really to think of Compassionate Certification Centers as a one-stop shop for your medical marijuana healthcare needs.
So where I get a little confused on this whole entire topic is when you say products. I get confused on when do I need a card and when do I not need a card.
Absolutely, and this is a very confusing thing, I would say, for most people, to be honest. So, generally speaking, if the medications contain THC in them, or that one cannabinoid, then those will need to be sold at the dispensary. And any medication that a patient obtains from a Pennsylvania licensed dispensary, they will need to have their medical marijuana certification card. Conversely, patients may often see that whenever you may walk into a local convenience store or maybe into your chiropractor's office, whatever it may be, and you'll see hemp oil or CBD oil. What that is, that's basically hemp is a species of cannabis that by default is very low in THC. So there's certain chemicals that we're able to derive from the hemp product by itself, and those products can be sold legally at stores outside of a dispensary. So that's essentially the way to look at it. If the products contain THC and it's derived from actual marijuana, they'll need to be purchased at the dispensary. Any hemp-derived products can be otherwise bought outside of a dispensary. Does that make more sense?
It does make more sense. And I know it's a bigger conversation than we can take care of today because it does get confusing. There's a lot of noise out there, if you will, with this being introduced into society and us understanding it and learning it. That's why I'm glad we have great professionals like you to explain it. And folks, if you're just listening and you're just joining us right now, what we're doing is we're talking with Dr. Brian Donner with Compassionate Certification Centers. And yes, there is one on East Cunningham Street. And if you have a question that you would like to ask, you can do that anonymously. You can give the question to Pat. Pat can give it to us, of course, Pat, our producer here. Or if you want to go on the air with us, we don't have to ask your name. If you just want to ask the question to Dr. Donner, you can talk to him right here. It's a free call. And if you have a question about maybe a condition, how the medical marijuana helps, how do you go about getting your cards, when do you need a card, you can ask that. The number is 283-2525, 283-2525, and the doctor is going to be with us for about 20 to 25 minutes. So this would be the time to just pick up the phone and give us a call, and we can go forward from there. So 283-2525. All right, so doctor, then if we're going through the products, and I would assume that we are with a professional to tell us which products to get, or do we go on our own to decide I need the oil or I need some other product?
Absolutely. It's another great question, Tracy. And I think whether you're talking any type of medical cannabis therapy, I think it should be ideally directed by a medical professional and somebody who has experience in that field. So I can tell you that at our clinics, we consider part of our job to help patients obtain their certifications and to actually get their medical marijuana card. However, the other part of our job, just like any other physician's office, is that we're able to provide ongoing support for the patients. So that might include not only outlining a treatment plan, but having follow-up with the patients, making adjustments based off of results and tolerability and things like that too.
Can you give us some of those conditions that would be listed under the required conditions, I guess you could say, that we would be able to use a medical marijuana card or go through this cannabis therapy?
Absolutely, and I'll give you some of the big conditions. So just generally speaking, in Pennsylvania, there's 21 different conditions that are approved for medical marijuana that patients are able to obtain their certification cards. Those can be found on the state website, which is basically medicalmarijuana.pa.gov. I would, starting sort of at the top, some of the more common qualifying conditions, I would say number one is chronic pain. Chronic pain is basically defined as any condition that's causing pain that's been present for greater than 3 months. PTSD, or post-traumatic stress disorder, is another very common certifying condition. Epilepsy or recurrent seizures, inflammatory bowel disease, which includes Crohn's disease and ulcerative colitis. And then you get into other type of maybe sort of less common disease entities, such as, let's say, glaucoma or Huntington's disease. Parkinson's disease is another one. Sickle cell anemia. So really there's a pretty wide variability over the different disease processes. And overall, right now, there's a total of 21 different conditions, and the State Department of Health and the advisory board is currently looking at adding more conditions to that as well.
So again, the phone number here is 283-2525, 283-2525 if you'd like to ask the doctor a question about cannabis therapy, medical marijuana, the cards, if you have a certain condition and how this could help. Now, when you're listing all of these challenges, these conditions, if you will, doctor, do we go to the Compassionate Certification Center on East Cunningham Street, or are we going to our PCP first? How does the path run for us to then obtain a card to continue on the process?
Absolutely, and I think that really the easiest way to look at this, Tracy, is that the first step is to have one of these underlying diagnoses, right? Most of our patients, from seeing whether it's their PCP or their specialist, will be previously diagnosed. So, for example, maybe a patient with diabetes has diabetic peripheral neuropathy, or maybe a patient with a skin cancer has been treated by the dermatologist. So, typically, what the patient will need to do, the first thing that they should do is literally just contact our office. That's the easiest thing. They can go online. They can contact us through our toll-free number. And then typically what will happen is our staff will walk them through that process. So just like any other physician's office, there's a process of obtaining medical records, of signing consents and release forms, getting registered on the state website. So facilities like ours were able to basically walk patients through that entire process. So if you ask me what the first step for a patient to do if they were interested in medical marijuana, I would tell them to simply pick up the phone and call our office, and then we can help them from there.
Does an individual typically, are they just diagnosed and then they can come to you, or typically have they been diagnosed and then they've started some kind of treatment and then they come to you?
I would say it's a little bit of both.
Okay.
But most patients, I would say the overwhelming majority, obviously, will have one of these diagnoses when they come to see us, right? So we won't be the ones diagnosing them with seizures or diagnosing them with glaucoma. They'll have already carried that diagnosis previously. So whenever they come to see us, at that point, many patients, their treatment plans have been variable. Some patients have never, ever before even thought about medical cannabis. Other patients may have tried medical cannabis in the past in varying forms. So it can really have great variability. Patients all the way up from those who are completely naive to patients that have been using cannabis for a long, long time. So quite amount of variability in that.
So can we stay here in Pennsylvania and have our choice of product, if you will, or do we need to travel out of state? And what are the regulations when we go from state to state?
Sure. So another fantastic question. So when you look at the regulations in Pennsylvania, those say that all of the medical marijuana needs to be actually, and this is the medications that are sold at the dispensaries, to be clear, but that all the cannabis, the marijuana, needs to be grown and cultivated in Pennsylvania, processed, extracted, and then sold in Pennsylvania. So all of the products at the dispensaries have been in Pennsylvania from what we call seed to sale. Now, whenever you go into the hemp-derived products, so i.e. the CBD or the hemp oils that maybe you might find at a convenience store, those are often brought in from out of state. But any product at a dispensary in Pennsylvania will have been grown, produced, and cultivated in Pennsylvania.
Dr. Brian Donner is with us. He's the CMO and co-founder of Compassionate Certification Centers. And Doctor, I chuckle, but I do it with respect. Please understand, you have so many letters after your name that I always chuckle with doctors. I'm like, you can tell us all of those. But you have Compassionate Certification Centers, and one, of course, we have at 127 East Cunningham Street in Butler. And Doctor, why do you think that this conversation is so important? Is it because it's so new to a lot of us, or is it because it's now a different process of thinking? Because when you say marijuana, we have that stereotype in our heads where that was illegal, and now all of a sudden we're having this conversation where we can get a card and get some products. Why do you think that this conversation is so important?
Yeah, and I think you hit sort of the nail on the head, Tracy. In my opinion, it's twofold. I think number one, just like you said, there's really breaking down the wall of the stigma that's been carried with cannabis in our country, particularly over the last, let's say 50 to 75 years. I think breaking that down is going to take some time. So that's really, really important. And then really piggybacking off of that, I think the education process, right? Whenever you look, even as physicians now, I wasn't taught about cannabis or the endocannabinoid system in medical school or in residency or in my fellowship. So this is true for most physicians and healthcare providers. So I think education starts from that level, and then there's a trickle down effect. So I think if we can really focus on more broad spread education as well as breaking down the walls of that stigma, I think those are the two key things to really progressing medical marijuana as we hope.